Thank you very much, and welcome everybody. I've got to reimagine healthcare by using big data and AI in about 10 minutes, so I'm going to have to reimagine very, very quickly. So I hope you're with me on this journey. What we've heard is the use of big data in the micro, in the genetic. What I'm now going to do is expand that out back out to the health system to start talking about how big data and AI might address some of the costs that that healthcare systems are wrestling with. A little bit about myself. I've written reports on digital transformation of the NHS in the UK. I've also been involved quite a lot recently in looking at digital strategy for Public Health England. My partner's doing a lot of work on writing books on strategy and transformational change. So we bring those elements together. So what I'm going to cover is a little bit of scene setting, talk about why big data and AI needs and digital transformation in general is so important. A little bit about what that digital transformation may take, what form might it take, and why we need to think about that change in a different way so that we can understand what data is important and how might we use it. I'll talk a little bit about some of the lenses in which to think about transformation, because it's not just about doing what we do now a little bit better. It is about change, as we've heard. And then I'll finish off with a little glimpse into the future about where artificial intelligence, or AI, is starting to take us, to give you some ideas and thoughts about what medicine of the future might start to look like. So first of all, I'll start by looking at the whole healthcare landscape. There's a lot of investment going in sickness at the right-hand side, because that's the cost that's ballooning out of control. And the UK, like most public health systems now, is saying we need to do something about prevention. We need to invest more in prevention to both reduce the incidence of long-term disease, but also start to be smarter about secondary prevention. How can we use insights about lifestyle behaviors to be part of a more holistic package of care? We know that this makes a significant difference to health outcomes. And also understand a little bit more about those social determinants we heard about before. Are there items here that we can bring into play that can inform how we shape our conversations with our citizens and our patients? The digital landscape brings all of this into view and gives us new data, new information from which to inform our decision making. And now is the time to make that transformational change. So, one way of thinking about technology transformation, this is something very current in the NHS, is to think that we have different layers of the system. Historically, we've constructed it such that we have primary care and secondary care. And as we move deeper into the system, it costs more to treat people, and there are less resources available, which means people usually have to wait longer. So digital transformation both can improve what goes on in those areas, but it can also start, if we use it intelligently, to think about, can we codify treatments and move them back upstream? So secondary care can become a primary care solution, or primary care could be a health nurse, or ultimately, could solutions be delivered direct to people to diagnose and support themselves? And if you think of things like pregnancy testing or diabetic test kits, those used to be secondary care functions. You can now go to the pharmacy and get something for €5 to test out. So digital transformation in general is about not only what goes on those functions, but can we relocate them to cheaper areas and right up potentially closer to the patient? So there's a lot of work going on digital transformation that indicates, as we've heard a little bit about how improving the internal performance of the healthcare system can be done. There's new treatments, there's sharing electronic records. In the UK, McKinsey's have had a look at this, and they reckon there are 8 to 14 billion pounds of annual savings to be had by just working smarter, more effectively. But of course, what does that mean, and how do we get the data out of that to measure it? That's an important question. But the big transformational potential is a new engagement with the public. We know that they're much more digitally enabled with their smartphones. There's a whole, as we'll see in a minute, whole much more sensors, wearables coming through. There's an opportunity to change the conversation with the public and helping them be more aware, guide them, coach them, and treat them more effectively through these kind of digital tools. So the role of data is changing. It's not just about epidemiological histories, as important as that is. It's start thinking about how the healthcare system becomes more organic. We move from transactions and politically, there's lots more interest in outcomes. How do we start to measure those and understand how those are delivered? How do we go from just pure measurement to system modeling? How is this all performing? And how do we go from just measuring delivery performance to become an active, learning, evolving creature? How does the healthcare system become more organic? So the challenge for digital health transformation is, do we think about it, and this is really important conceptually, do we think about it as terms of just digitizing the things that we do today? Is our existing delivery model of healthcare the best model, and is it simply digitizing that? Or is it rethinking what healthcare is in a digital world? Because we might be able to serve the outcomes or the goals that we're looking to achieve through radically different ways. And I would argue it's rethinking healthcare in a digital world that is our major opportunity. As one person senior person in Public Health England said, it makes no sense, Andy, if we start building digital wheelbarrows. Wheelbarrows may have been a great thing in the past, but to digitize it makes no sense. We need to rethink new models of healthcare. So why do we think this is even possible? It's all great, the rhetoric, but what's transformational are the digital tools that citizens and patients now have in their hands. So if we look at the traditional health or traditional behaviors, most health behaviors, be it lifestyle behaviors or adherence behaviors, are located in a daily rhythm. And when you zoom into that, those rhythms are usually quite distinct patterns of behavior. They may change at the weekends or during the day, but they're very distinct patterns. And guess what? People are usually with a smartphone that follows them around those daily patterns in the context in which things are happening. So we have a privileged platform to get deeply into the sort of micro moments and contexts of people's lives, to nudge, to influence, to inform, to notify, to support. So in the UK, for example, smartphones are used already by over the 80% of the population. They're checked, on average, do you get this? 150 times a day. People are checking their phones. So it's already by far and away the biggest access to the digital world, and there's a whole bunch of digital apps building around that. Furthermore, we're getting a whole bunch of wearables associated with those smartphones and linked into it. And there's a whole growth industry of Internet of Things, sensors in the home, sensors in the environments. And there are a lot of developments coming through now in terms of sensors that are attached to the body or inside the body to start measuring in real time some of the physiological aspects. So sensors are going to be present in those daily rhythms to give us essentially rich access to contextual information to change the health conversation that we have with patients and citizens. So I'd like to draw your attention to sort of what I call the 4 Russian dolls of big data and health innovation. Design 1 is the one that we're most familiar with. That's taking a particular intervention, a particular interaction, and saying, how can we use digital? And by looking at a particular problem, it's usually fairly self-contained. You need to look at it, design for it, and data will allow us to understand, have we optimized that both for the healthcare system and for the patient? Design 2 is where I think some of the biggest opportunities to do some of this rethinking occur, because this is about not only just looking at a particular intervention, but looking at a model of care and saying, can we reimagine what this looks like in a digital world? Here, I think, are some of the big savings that we can get. The risk of not thinking about this is that we, as someone said, start putting digital baubles on the old Christmas tree. The old care model simply has digital pieces on it that actually end up making it more complex and expensive. And this is a risk. Can we rethink care pathways and care management using digital to actually take cost out of the system and provide a better service to patients and individuals? So there, big data is really starting to look at, are we optimizing care delivery? Is it quicker? Is it cheaper? Is it better? Is it delivering better outcomes for patients? But that's not it. Design 3, and this is where it gets challenging, is thinking about how do we start to rethink the structure of the healthcare system. At the moment, we have lots of isolated pieces working in separate silos. Can we start with digital to start thinking about how secondary care, primary care, and other elements of care get brought together, sharing the same data, being able to work more effectively as an integrated system? And their data will start to play an important role of saying, are we optimizing and improving the entire healthcare system? And finally, it's not stopped there, there is one level more, Design 4, which is really looking at the social and political. We know that health is not just about treatment and clinical outcomes. It does include population health in terms of social behaviors, lifestyles. But in the context of that wider set of factors, we need to be able to obtain the data to understand what are those other social factors so that we can inform policy and regulation at a greater level to shape the entire societal and political discussion around health. That's where the real savings are going to come. And big data can play a great role in starting to show how overall population health can be improved through looking at that. So let's dive into a couple of quick examples. In the UK, Design 1, very small one, but it's an example of some innovative thinking. A sugar app was launched this year for the UK public to try and get them more aware of sugar and what it can do. And essentially, it's a very simple app. You download it, you scan the bar scan on any food, and it will play a little cartoon showing how many sugar cubes there are in it. It's understood from research that this is a better way of showing how much sugar there in there. It's downloaded 2 million times, 40 million scans, and what it provided is rich data about what types of food and drinks people are interested in, what they're concerns about, which provided a basis to think about a different kind of personalized conversation with the population around sugar. One of the major drinks manufacturers actually experienced a double-digit reduction in sales during the course of this, so it had a direct impact on population health. Quick look at a Design 2, looking at pathways. I'll race through this very quickly. Hospitals are looking very much at how to improve patient experience. So there's a flow through the hospital, which at the moment is very disjointed. Using digital and getting data allows us to model that. But when you speak to patients, it's more about what goes on outside the hospital that concerns them. So it's managing conditions, managing access to doctors, being able to understand their condition and engage others, and gaining support. So these other items around the hospital process are ripe for innovation and opportunities for digital and data to give us a better understanding of how people manage their care. So in Public Health England at the moment, this is facilitating a rethinking about health. Rather than throw in interventions at the public, do we need to start thinking about a more holistic data model? We heard a lot about the genome and age. We know physical and mental health impact each other. But we know there are a whole bunch of behaviors, eating, drinking, addictions, mental health. We know there are the social determinants of health that maybe we start to need to be measuring. And we know that we can start to capture risk factors that enable us to change the conversation around health behaviors, to modify those in respect to those risk factors. And as people become sicker with diabetes and other long-term conditions, again, an opportunity to change the conversation. But we need to start moving away from discrete, splintered conversations to more holistic understanding, more holistic dialogue with individuals and citizens about how best to support their health. Getting this understanding enables the healthcare system to get smarter at prevention, more targeted for those at risk, and more finessed in terms of how it supports individuals with long-term conditions around not just the clinical, but all the surrounding supporting factors that influence outcomes. What this enables is by capturing data out of this, and CRM, for those who are not familiar with it, customer relation management, horrible expression, but it's essentially creating a personalized database for each individual citizen to understand what's going on there. It allows deeper understanding of holistically all those factors that can drive insight, policy development, and that insight is fed through to universities to understand, so it's rich data that comes from there, that can then inform a more enlightened conversation with local authorities, with schools, with commercial partners in the third sector, to keep this becoming a learning system where insight starts to drive learning. That purple box at the top there, the National Health Service is introducing an app endorsement program, very interestingly, next April. So essentially, it's recognized that this digital innovation can't occur just from within itself. So it's inviting the external market to come and bring apps to be considered in support of delivering a broad range of population health and clinical outcomes. If you're interested, come and see me afterwards, I'll tell you more. So, a glimpse into the future. We've heard that integrated care is really, really important, and there are a whole bunch of care providers, primary, secondary care, public health, a bunch of actors that are bringing, at the moment, their services together. And data and big data is great and important in terms of that conversation. But, here's the interesting thing. Work by Kaiser Permanente has shown that even with long-term condition patients, the amount of time that a patient spends with their healthcare professional is typically less than 0.1%. Over 99.9% of their time is spent on their own with their condition. That's interesting because health happens or not in the 99.9%, not in the 0.1%. So what can we do in a digital world to support this new paradigm, patients outside of the healthcare system? Well, as we've heard, there's lots and lots going on in terms of new services for developing support for behavior and well-being tracking. There are lots of developments coming through in terms of being able to track various aspects of your physiology. We're not far away from a time where real-time data is going to be streaming out of people that gives us really rich insight as to what's going on, early diagnosis, in-time, real-time, in-context intervention support and coaching. And what the next generation of big data analysis, machine learning, deep learning is moving to is artificial intelligence. And that's the ability to respond and learn and adapt and give personalized support to people. So in the future, there are a lot of commentators saying we're probably moving to a world where artificial intelligence is going to be able to take that real-time data out of the 99.9% of people's lives and be able to turn that into a clinical or coaching conversation. We probably will see the rise of digital doctors and digital health coaches supporting people in context, working in partnership with true healthcare professionals. And that's a very interesting space. However, it comes with challenges. Customers, patients, depending if you're a private or public healthcare system, that journey comes with risks and issues. There's a sense that we're now collecting and using more personal data. Is this about mass surveillance and invasion of privacy? How do we not freak people out by collecting this data? These algorithms that will drive this, have we truly understood their goals, and would they go off and do weird things and have unintended consequences? And part of the facet of artificial intelligence is it teaches itself. How do you change its direction once it's already coded itself in ways that are perhaps beyond our understanding? Are we happy with handing over aspects of patient care to algorithms? You can see there's some logic for it. But is this where we want to go? Are we losing some control, potentially, over how AI might run some aspects of health and care processes? And how do we handle moral and ethical judgments if computer code is managing things rather than human interactions? What does human intelligence mean? What does care really mean? This technology is forcing us to think deeply about what it is that care really is and how we want that to manifest in the future. So a couple of takeaways to finish off with. Adoption of digital will grow and grow. It gives us a new context to start reimagining how we deliver healthcare. And I can't stress this largely enough. It's reimagining what healthcare can be, not just digitizing what we do. This will bring lots and lots of rich insights that will drive us much deeper and richer understanding of what's going on. Big data modeling will help us to understand and inform changes in interventions, thinking about strategy and policy development on the broader landscape. person-centered data models will be key. More partnerships with the private and public sector, because private sector has a lot of technology that can help us there. And there will be some issues about how we take this new transformation forward in a different conversation with our publics. But I would leave you with, think big, start small, move fast. The time is now. Thank you very much.